Yeah, so it's obviously a sad day for the Murrumbidgee Local Health District and for our community. We've had our first patient who passed away from COVID-related disease. It was a patient who passed away in the intensive care unit at Albury Base Hospital. We obviously extend our condolences to the family, and we ask that the community respect the privacy of that family who's going through a very tough time. In terms of another update is that despite the sadness of the patient passing away, luckily we've only had one additional case overnight, which now brings the number of cases in the Murrumbidgee Local Health District to 41. We've done in excess of 1,900 tests in our own testing facilities, and there would also be some tests conducted with private providers. So in terms of our own testing, we've pretty much tested 1 in 130 people who live in the Murrumbidgee Local Health District, which is actually very good. And what the community also need to remember is that we're only testing symptomatic patients because there's very, if any, benefit in testing patients who have no symptoms. All right, well, in terms of... Sadly, I don't have the exact age at this time, but that will be made available at a later time. So sadly, I don't have that information, but we will provide that with you with our update.
Dr. Bruce, with that patient, were they, I understand there were 10 people self-isolating at home, one was in hospital, but then one got taken yesterday. So was this a patient that was at home and then suddenly needed hospital treatment and was taken in and then died?
I don't have that level of clinical detail about the patient. Sadly, we only got the information this morning, so I don't have that level of detail at this time.
And obviously only one extra case overnight. Can you tell us which local government area that was in?
So that was in Wagga, and that's in keeping with the trend in New South Wales. So if we look at in the last 24 hours, there's only been 90 new cases in New South Wales, which is the first time since the 22nd of March where we had less than 100 new cases. So clearly from that it looks as if the measures that has been put in place is proving to be effective. There is obviously concern about the patients where we do not know the source of transmission, and once again we're planning for the worst and assuming that there's community transmission. And in New South Wales there were 333 cases where the source of the infection was unknown. But once again, considering that there's almost 2,500 cases, it's still a very small percentage. So the community needs to understand the importance of following the social distancing rules. Because I've said before, and I'm sure I sound like a broken record, but the solution for COVID is in the community and preventing the spread of disease. So it really is important that we all work together to make sure that we keep our families and ourselves safe.
Dr. Bruce, from the Border Mail, since the testing started in Deniliquin, do you know how many people have been tested?
Sadly, I don't have that level of detail. I know the total number of cases.
3 on Tuesday and 5 the day prior. We're waiting for the testing numbers to come through.
Yeah.
So about 8.
Yeah, so it would be a reasonably small number, but I think yesterday at Wagga we only had 13 patients tested. Now, the testing criteria has been expanded, so potentially we could end up doing more tests, which is actually a good thing. And I don't think the community should be alarmed that when we do more testing and there's a few more tests that come back positive, because it's better for us to know that people are positive and for them to self-isolate than for them to be in the community and we don't know and they don't know. So I don't think people should be alarmed. It's not all about numbers. It has to be taken in the context of what we're doing in terms of current testing. And I do feel sorry for the community because things are changing quite rapidly, but I can tell you that we make sure that our testing criteria is absolutely up to date with what's recommended currently.
So with the expansion of testing to other people, not just those who have been overseas or in
Yes.
contact with someone overseas, are you expecting that number of community transitions to possibly increase?
It's difficult to say because one of the problems is we don't know what the rate of community infection is. There has been some studies from overseas where people have tested whole towns, which is, almost the whole country like in Finland, but that works well when you only have 250,000 people. So it's difficult to say, but my guesstimate would be is that if we test more, we will identify more patients. And remember, we'll still only be testing symptomatic patients, but we do not require them to have what we call the epidemiological criteria, in other words, travel overseas or in contact. So what would happen now is if a patient sees their GP and the symptoms are, consistent with potential COVID and their GP feels that they should be tested, they'll be tested.
With that, considering that some people who have tested positive aren't showing any symptoms, how are you going to sort of curb that if you're only testing people who...
Yeah, so the rates of people testing positive with absolutely no symptoms is actually quite low, because some of the symptoms can be very mild, and we know that 80% of people have very, very mild symptoms. And once again, people's comments about symptoms, I may have a bit of a runny nose. I don't see that as a symptom because I normally have an allergy. But if you go and inquire quite vigorously, but a runny nose could be the only symptom of COVID disease. The other thing to remember is that we're not sure what the rate of asymptomatic transmission is. In other words, what is the chance of somebody having no symptoms transmitting the virus to other members of the community? And that does make it difficult for us. The one thing to remember is that if somebody who's asymptomatic is tested and the test is negative, the value of that test is almost zero, because they can still become symptomatic later on. And we had a number of requests for testing in people that were in contact. And some of the requests we get are people that have been told to self-isolate for 2 weeks, but they want to go back to work. A negative test does not shorten the period required for self-isolation. So that's absolutely important, because if I'm told to self-isolate for 2 weeks and I'm tested on day 5, and I test negative, it's of no value, because I can still become symptomatic in the following 9 days. So that's really important.
The other thing was, I know that a couple of days ago you had a previously confirmed case come back negative.
Mm-hmm.
Are you going to be doing more secondary tests now after that?
So what would happen normally in a laboratory is that if they have tests that are, a low positive test or a dubious, that they would retest the patient and then provide us with a result. The way that I would look at it, if there's any doubt, I would rather isolate somebody. And in other words, I'd rather have a false positive than a false negative. I think in terms of testing, one of the other bit of information that we should share with the community is the use of blood tests for diagnosing COVID-19 disease. And we know that there are some what we'd call point of care testing, where you can have a finger prick and you can be tested. The problem for that with those tests are that they only become positive 5 to 10 days after the patient is infected, and they're actually infectious. So the problem is that you can be infecting people around you and still have a negative test. So I cannot stress it strongly enough that currently blood tests have absolutely no role in diagnosing COVID-19 disease. So sadly, the only way to get tested is to have a swab. It's not pleasant, but that's currently the best way. And I can tell you there's a lot of work happening all over the world to get the test done more quickly and more rapidly. And New South Wales Pathology is actually evaluating as tests are coming to make sure that they are appropriate.
Another question from Aubrey.
Yes.
How much cooperation is going on over the border with the Victorian authorities?
So there is absolutely very close cooperation with the public health units, and they work very closely together. But then in regards to our clinical relationships, that is as per normal, because remember, we work together with them with other patients too, not just patients with acute respiratory illness, and we follow the normal collaborative approach as we do with our colleagues.
Also with Aubrey, Can you just give us the link as to why those sort of services need to halt in light of COVID-19?
Yeah. So that would be very, very similar to the ear, nose and throat procedures, like children having their tonsils out. And really it is just because you've got a large group of people in very close proximity to the patient's airway, and obviously when the dentists irrigate or suction, there is a risk of generating aerosol particles, which if you don't have a P2 mask you could inhale and then become unwell. So really it is just an infection control measure, and once we get through COVID-19 disease, we'll re-establish those services. But that has been with advice from I think the Australian Dental Association as well. There has been comments on that. Obviously patients who need emergency treatment will still be treated, but it's the same as with surgery. We're just trying to minimize risk.
And maybe just one final warning, I guess, we now have a death in the region, one extra case, just any additional health advice for those out there in the community?
Yeah, so as I've said before, cough etiquette, hand washing, hand hygiene is absolutely essential, because remember, the only way that you can get COVID disease is from another person. And you have to actually either touch them or touch a surface that they have contaminated. So if we make sure that our hands are clean, we don't touch our faces, which a lot of people do, and then make sure that we maintain the social distancing. It is disappointing when people do not follow the rules, because remember, the only way that we can be safe and keep our families safe is for everybody to do the right thing. But I think people are doing a great job, and I'm sure we'll get through it.